In this video, we'll discuss about pneumonias, various type and histopathology. Overview of respiratory system. Human have two lungs. One is right lung, another one is left lung. This right lung having three lobes, upper, middle and lower lobes. Left having two lobes only, upper and lower. Don't have middle. The middle lobe is represented by lingula. So right lungs having three lobes, upper, middle, lower, and left having two lobes only, upper and lower only. Then middle part represented by lingula. Then respiratory system are divided into two types, upper respiratory system and lower respiratory system. What are the things considered as upper respiratory system? Nasal cavity, oral cavity, then pharynx and larynx. Lower respiratory system, larynx open into lower respiratory tract which started from trachea. So now what is the meaning of upper respiratory tract and lower respiratory tract? This is the nose and mouth of human. Nose open with nasopharynx, mouth open with oropharynx. Both of them open hypopharynx. It is called pharynx. After that we have larynx. After the person have trachea. Trachea divided into bronchi. Bronchi. This bronchi, primary bronchi, secondary bronchi, tertiary bronchi, then terminal bronchioles. Then this one alveolar duct, then alveolar sac. This respiratory bronchioles, alveolar duct and alveolar sac. These three things together considered as respiratory bronchioles, alveolar duct and alveolar sacs. Three things considered as sinus. So three things, respiratory bronchioles, alveolar duct and alveolar sac. This one considered as sinus. This one is the respiratory tree. Then what is pneumonia? This respiratory tree divided into two parts, above larynx, upper respiratory tract. Then the portion below the larynx, this known as lower respiratory tract. Above larynx, upper respiratory tract, below larynx, lower respiratory tract. So what are the things considered as lower respiratory tract? Trachea, bronchi, principal bronchi, then bronchioles, primary, secondary, tertiary, terminal bronchioles, respiratory bronchioles, then alveolar duct, then alveolar sacs. So pneumonia is the disease of lower respiratory tract. The disease in respiratory bronchioles, alveolar duct and alveolar sac. This name is called as sinus. Here disease causing, this name is called as pneumonia. So that sinus is the structural and functional unit of lungs. This sinus, these three things considered as structural and functional unit of lungs. How? The glomerular is the structural and functional unit of kidney, like that only. This one, this sinus considered as structural and functional unit of lungs. Till bronchi cartilage. This larynx, trachea and bronchi. These three things cartilage. onwards or after that cartilage is absent. Bronchi, after that cartilage is absent. Larynx, trachea and bronchi having cartilage. So what is pneumonia? The last three structure having inflammation. Respiratory bronchioles, alveolar duct and alveolar shock. These three part having inflammation, that name is called as pneumonia. Then who is causing inflammation? It can be bacteria or virus or fungi. Three type of organism causing pneumonia. Who is causing pneumonia? It may be bacteria, virus or fungus. Bacteria causing pneumonia name is called as bacterial pneumonia. Virus causing pneumonia name is called as viral pneumonia. Fungus causing pneumonia name is called as fungal pneumonia. So that was the overview. So summary, trachea divided into two bronchi, left and right. This one is the principal bronchi. Then this one is bronchioles. It having three things: primary, secondary, tertiary. After that terminal bronchioles, then respiratory bronchioles, alveolar duct and alveolar shock. The balloon like diagram name is called as alveolar shock. Last three part name is called as sinus. Two types of pneumonia: lobar pneumonia, lobular pneumonia. Lobar pneumonia means lobes are involved, upper, lower, middle, like that. Lobes involved means lobar pneumonia. Lobular pneumonia means this part involved means that patchy involved means that one is the lobular pneumonia, one patchy involvement. Lobules, lower respiratory tract, terminal bronchioles, respiratory bronchioles, alveolar duct and alveolar shock. This part, this one is the terminal bronchioles. After that, this one is the alveolar duct. This one is the alveolar shock. This one is the one patchy. Okay, one lobes. This one affected means that name is called as lobular pneumonia. So how we will define that lobes? What is lobes? Lower respiratory tract, terminal bronchioles, respiratory bronchioles, alveolar duct and alveolar shock. This terminal, this one is the terminal bronchioles, 3 to 5 terminal bronchioles. From one terminal bronchioles have multiple respiratory bronchioles. One respiratory bronchioles have multiple alveolar duct. Then one alveolar duct having multiple alveolar shock. These whole things considered as lobules. So these three things considers, this one name is called as lobular pneumonia. So pulmonary lobules, a cluster of 3 to 5 terminal bronchioles, each with its appended sinus, refer to pulmonary lobules. So pulmonary lobules include a cluster of 3 to 5 terminal bronchioles along with its respiratory bronchioles, alveolar duct and alveolar shocks. This is lungs, this is trachea. These two things are two bronchi. Right lungs having three lobes, upper, middle, lower. Then left lung having upper and lower. Entire lobe involved means lobar pneumonia. It may be upper, middle, lower. Entire lobe involvement name is called as lobar pneumonia. Continuous diffuse, fully affected. Lobular means patchy. This one patchy. Here that patchy diffuse. This one is the consolidation patchy. Name is called as lobular pneumonia. Next, histology. Respiratory tract is lined by pseudo-stratified columnar epithelium. Respiratory epithelium. Pseudo-stratified columnar epithelium. Pneumonia. How to define pneumonia? Acute inflammation of lungs, parenchymal, distal to the terminal bronchioles. They have three things. What are the three things? Respiratory bronchioles, alveolar ducts and alveolar sacs, collectively known as sinus. So this is consolidation of lungs. Next, how that organism reach inside. Microorganisms enter into the lungs by one of the following four routes. First one is inhalation, aspirations, homogeneous spread and direct spread. What is inhalation? Inhalation, that microbes presented in air, through inhale it will reach to lungs. The homogeneous spread, from distant focus of infection, through blood it will reach to lungs. Third one is direct spread, uh, from adjoining site of infection. Say for example, nearby the structure, organism presented in heart, so that organ near to lungs, so directly jump into the lungs. So heart to lungs it will directly jumping. That name is called as direct spread. So inhalation, through inhale it will enter. Homogeneous, through blood it will enter. Direct, by nearing organ it will jumping directly. Then what is aspiration? Through food particles. Say for example, this one is the nose, nasopharynx part here. Then our mouth having oropharynx, then together here hypopharynx. After that here food and air mixed together in hypopharynx region. Larynx have the structure epilytics. This get closed, so only food go to that esophagus, not to trachea. But sometimes epiglottis not closed. If talking during eating, food will go to trachea. Then this process name is called as aspiration. So food containing bacteria, fungus, virus, protozoa, that will reach acids, causes inflammation. So this process name is called as aspiration. Food particles go to the trachea. It chances for bacteria, fungus, virus, protozoa. This one reach the acids, causes inflammation. So these are the four route: inhalation, aspiration, homogeneous and direct spread. Next, classification of pneumonia based on the first one is based on the anatomical region of the lungs parenchyma. Second one is based on the etiology and pathogenesis. Third one is clinical setting in which infection occurred. So classification, how many types it have? Three types: anatomical region, etiology, third one is clinical settings. So first one is based on the anatomical region. Three type of pneumonia: lobar lobar pneumonia, lobular pneumonia, and interstitial pneumonia. What is lobular pneumonia? Lobar pneumonia, lobes involved. It diffuse, fully affected. Lobular means it also have name bronchopneumonia, lobules involved, patchy. Third one is interstitial. Here background, connective tissue structure it is involved. So lobes involved means lobar pneumonia, lobular pneumonia, patchy. Then interstitial means background structure. Then based on their etiology, who is causing inflammation? Bacteria causing pneumonia name is called as bacterial pneumonia. Viral causing pneumonia name is called as viral pneumonia. Pneumonia from other etiology, it mainly because of fungus, it called as fungal pneumonia. Then clinical setting. First one is community acquired pneumonia. Any person in society. Okay, any person, you, me, any person affected means community pneumonia. Second one is healthcare associated pneumonia or nosocomial pneumonia or hospital acute pneumonia. This one patient admitted in hospital after 24 hours, then they get infection name is called as healthcare associated pneumonia. Third one is ventilator associated pneumonia due to any disease, example COVID. This one not important. So based on their anatomical region, based on their etiology, based on their clinical setting, three type of pneumonia. So classification based on their etiology, bacterial pneumonia are classified into two types, lobar pneumonia and lobular pneumonia. This lobar pneumonia having 4 stage, lobular having only 1 stage. But that viral and fungus pneumonia only interstitial, not involved in lobes and lobular. So this one this one is the lobe, any lobe or entire lobe. This one is the patchy. 1, 2, 3 lobes involved. This one is the lobular pneumonia. This upper part, this one is the lobes. So lobar 4 stage, lobular 1 stage. Viral and fungal pneumonia only interstitial, not involved in lobes and lobular. So fungus and virus always interstitial, also known as atypical pneumonia, not involved in lobe and lobular, only connective tissue. So only background only. Bacterial pneumonia, lobar bacterial pneumonia, it having 4 stage. So this one is the lobar. This one is the patchy. This one is the continuous. This one is patchy. Lobar pneumonia is an acute bacterial infection. It is an acute bacterial infection of a part of lobe or entire lobe, even 2 lobes of one or both of lungs. Condition frequent in adult. Most common bacteria causes bacterial pneumonia, pneumococcal pneumonia. More than 90% of all lobular pneumonias caused by Streptococcus pneumonia, then Staphylococcus aureus, then streptococcal pneumonia, beta hemolytic streptococci. Some common gram-negative aerobic bacterium, Haemophilus influenza, Klebsiella pneumoniae, Pseudomonas, Proteus, and E. coli. But predominant one, more than 90%, Streptococcus pneumonia only causing pneumonia more than 90%. Pneumococcal pneumonia caused by Streptococcus pneumonia. Then they having 4 stages. What are the 4 stages? Stage 1 name is called as stage of conjunction. This one is the initial stage. It take 1 to 2 days. After affected lobe is a large, heavy, dark red and conjuncted. Second one is red hepatization. This one is the early consolidation. Third one is gray hepatization. This one is the late consolidation. Fourth one is resolution. So these are the 4 pathological phase of pneumonia. Stage 1 name is called conjunction, then red hepatization, gray hepatization, and resolution. Now we will discuss one by one in detail. Stage 1 for first 2 days, 1 to 2 days. If you cut it, make a slide. This is the slide. In this one, this circle, the circle structure, this one is the alveolar shock. Then pulmonary capillaries, this one is pulmonary capillaries. In between pulmonary capillaries, they are dilated, that's why looking red. Then edema containing 2 type of cell inside here. Full edema, it containing 2 type of cell, RBC and neutrophil. So edema containing 2 type of cell, few RBC, few neutrophil. By using syringe, take out that fluid, edema fluid, and do microscopy. You can find out bacterium. What bacterium? Chain. So Streptococcus bacterium we can find out. So stage 1, it take 1 to 2 days. So here 4 things we can isolated. One is dilation and conjunctions of that capillaries. Second one is inside edema fluid is presented. Then few RBC and neutrophil presented. Then gram staining we can find out bacteria. This is the first stage, conjunctions. Coming on second stage, red hepatization. What is the meaning of hepatization? Why we are calling lungs as liver? Normal liver like a spongy, liver like stone, hard, liver like a stone, hard. Here spongy lungs is converted into stony consistency, so it looking like liver. That's why calling hepatization of lungs. So consistency wise, lungs converted into liver. So the term hepatization in pneumonia refer to liver like consistency of the affected lobe on cut section. Initially color is red, so it have that name, red hepatization. It takes 2 to 4 days. Third stage, color change into gray, so gray hepatization. Then grassy, affected lobe is red, frame and consolidated. Cut, the surface of the involved lobe is airless, red pink, dry, granular, has liver stone like consistency. Red hepatization, early consolidation 2 to 4 days. Here, if you this one we will cut, this one is the microscopic view. Here abundant RBC and neutrophil is presented. It is filled with exudates. Again see, this one is alveolar shock in a balloon like diagram. Under this balloon we can see many RBC and neutrophil. Stage 1 there are few, but this stage there are abundant. Not edema here. Stage 1 edema, but stage 2 filled with exudates. Stage 2 exudates. Stage 1 edema. Stage 3 gray hepatization. Here it will take 4 to 8 days. The affected loaf is firm and heavy. Cut surface is dry, granular, gray in appearance with liver-like consistency. Change in color from red to gray. Benign at the helium and spread towards the periphery. So here it become gray in color. We will do microscopy. Here stage 2 having lot of neutrophil and RBC. Here neutrophil as well as RBC level decrease. Here macrophage, this one is the macrophages will appear. Unilobulated macrophages appear. This macrophage will eat that pus. So everything clear zone. So here we can see clear zone. Here neutrophil and RBC count decreasing, then macrophages will appear. That macrophages are unilobed macrophages. Then macrophages will eat that pus. Second stage having pus, no, it will eat exudates. So here everything disappear. So clear zone is presented. Stage 1 0 to 2 days. Stage 2 2 to 4 days. Stage 3 4 to 8 days. This stage 4 8th days onwards still 3 weeks. Fourth stage name is called as resolution. Here everything will disappear. The lobe become normal. It is a lobular pneumonia. Macrophage will eat everything. Macrophages also disappear. Here and comparing to third stage, here less amount of macrophages only presented. Alveolar become free. Here free. So here free. So air will come again. That is known as resolution. Stage 8th day onwards still 3 weeks. Everything disappear. So macrophages also disappear. Lobe become normal. So here gray, here red. So second one, lobular pneumonia. It is also called as bronchopneumonia. It have only one stage. Infection of terminal bronchioles. This one will affect extreme of age, infant and old age, not in adult. Then etiology, same organism, but their most lobar pneumonia, most predominant one is pneumococci. Here mixed organism. All are most common: Staphylococcus, Streptococcus, Pneumococci, Klebsiella pneumoniae, Haemophilus influenza, gram-negative bacilli like Pseudomonas coliform, all are. Then grassy, patchy area of consolidation. This is bilateral. Lobar one is monolateral. Here lower zone involvement. Then we cut the surface. These patchy consolidated lesions are dry, granular, red or gray in color, 3 to 4 diameter, slightly elevated over the surface. This one is the microscopic view. Here 3 to 4 terminal branchioles, 3 to 4 terminal branchioles along with acinus present. This balloon on this one is the edema, this one is the conjunction, then this one is the terminal branchioles. 3 to 4 terminal branchioles is present. Here neutrophil exudate also present. That means what is exudate? Here presence of RBC and neutrophil. So RBC, abundant of RBC and neutrophil presented in terminal branchioles and acinus. So this is all about lobular pneumonia.